The name of the session was Evaluating Disability, and it talked about the long winding road of getting our patients back to work. The most common condition that we see in our practice are people who have depression. That gets them off work, and depression really accounts for a huge amount of the disability, the economic effects of disability in our country. We're talking to psychiatrists, trying to help them understand some strategies that they can use, both in starting with their patient who says, I might be disabled, I don't think I can go to work, and how to change some of the things we do so we can advocate.
For the last couple of years, APA has been finally wanting to collaborate with employers. So I really want to come across as I'm not the enemy, the employers are not the enemy in advocating appropriate psychiatric care to get people off work and also to help them come back into work. They are now being put in a larger context where they're also having to answer to the employer by the patient's doing, because the patient is bringing a form saying, I believe I can't work. So the psychiatrists are now immediately placed in a role where they're challenged to, do you just advocate for your patient, or do you also have to advocate for the merits and value of working? And sometimes that isn't always what a patient is looking for.
We need psychiatrists to think of the fact that their adult patients being off work is a psychiatric emergency. We've got to work pretty intensively with them, trying to help them get some relief from their symptoms, reduce their impairment so that they can reclaim their job. If people are out of work too long, they'll never get back to work. So we need to address this as a really urgent kind of thing.
By it being an emergent crisis, then you have to sort of manage the treatment approach very differently than just sort of a every 2 or 3 month medication check. Consider engaging outside resources such as other mental health professionals and certainly family members to help make sure that they can get themselves to first bought into the idea that they need to come back to work, and then whatever you need to do to help them get back to work. I actually think working is a good thing. The reality is that people are taking time off for mental health reasons is a growing number in the workforce, but I don't know that it really serves people. I think the idea is that helping them stabilize quickly enough to then get back into the workplace is a sort of redeeming quality of work and functioning in the world.